Hello, I'm joined by my colleagues Jackie James, who is Director of Patient Communications, and Tammy Grow, Director of Scientific Services. We're here to discuss Parexel Medcom's commitment to diversity, equity, and inclusion. Jackie, can I start by asking why diversity and inclusion are important to Parexel Medcom?
Yeah, absolutely, Dave. Put simply, patients really are at the heart of our philosophy here at Parexel. So engaging with a diverse range of patient voices from various backgrounds really does lead to better discussions and then solutions and ultimately better outcomes for our patients. So for us in Parexel Medcom, we can develop inclusive, relatable communications that truly resonate on a human level.
Fantastic. And Tammy, which resources are available to ensure communications embrace diversity and inclusion?
Dave, there are actually two key resources available: the Journal of the American Medical Association Guidelines and the AMA's Manual of Style. We're currently developing our own editorial and cultural guidelines as well, which are in line with these publications. And we want to ensure that all terminology, language, and references used are inclusive, whether we're using manuscripts, abstracts, posters, or patient recruitment materials. And as the language and preferences evolve, we'll continue to update our guidelines to reflect any sociocultural changes as well.
Okay. Jackie, why is diversity and inclusion important for clinical studies?
Well, this really is where the value of the physician's role is paramount. So in order to communicate effectively, the medical community must be relatable and must be able to demonstrate empathy to patients and to their families, and particularly those from historically underrepresented communities within clinical research. So we can support this through targeted training using sensitivity to real-world needs of varying patient communities.
Okay. And Tammy, if I come back to you, how will diversity and inclusion be reported in journals and publications, for instance?
Well, Dave, all articles submitted to JAMA must report age, gender, socioeconomic factors, race and ethnicity in the methods and results sections. And authors need to bear in mind, if one factor is missing, then they need to provide a reason for omission. And they need to give as much information as possible when reporting on racial and ethnic categories, even if these categories contain small percentages of populations.
Okay. And finally, Jackie, what do you see as the long-term benefits of diversity, equity, and inclusion?
Well, Dave, if we can continue to partner with patients from all backgrounds while strengthening trust between the patient and the medical communities, then the true benefit will really be to be able to deliver accessible, patient-focused trials which have robust and inclusive data, which is then really clearly communicated to our global patient population. And I really do see this as the long-term benefit for diversity, equity, and inclusion.
Thank you very much. Thank you both for your time today.
Thank you.